Today, we are going to be discussing nosocomial infections. This is such an important subject to discuss because the U.S. Center for Disease Control and Prevention identifies that nearly 1.7 million hospitalized patients annually acquire nosocomial infections while being treated for other health issues, and more than 98,000, 1 in 17, die due to these. So, we all need to get together and come up with a solution to fix this problem occurring in the healthcare system. Our learning objectives today are going to be to understand what a nosocomial infection is, comprehending the danger and expense of nosocomial infections, learn which types are most common, and understand ways to reduce nosocomial infections in the healthcare field. So, what even is a nosocomial infection? It is an infection that is acquired after being in the hospital setting for more than 48 hours. According to the CDC, 1 in 31 hospital patients will acquire a nosocomial infection during their stay. And in 2015, 687 patients total suffered from a nosocomial infection. They are such a big issue in the healthcare because they cost hospitals anywhere between an extra $600 to $5,000 per patient, which is estimated to total $97 to $147 billion annually. This is because the infection can be something as simple as a UTI, a bladder infection, or even something as serious as pneumonia, a lung infection. So, now that we know about what a nosocomial infection is, let's discuss some of its background. There has been long-standing awareness that the practice of medicine can do harm as well as good. An American natural sciences writer noted that nosocomial infections are now killing around 100,000 people, many more than HIV, cancer, or even road traffic accidents. The Hungarian obstetrician, Dr. Semmelweis, identified the mode of communication and spread of puerperal sepsis while working at the maternity hospital in Vienna. He introduced chlorinated lime hand washing to the obstetric hospital staff, resulting in large improvements in maternal mortality rates. However, Semmelweis' theories were dismissed by most of the medical establishment because of a lack of appropriate statistical analysis. After cautious postulates were published in 1890, the germ theory of disease and Semmelweis' theory of transmission of disease from doctor to patient were found to be valid. Semmelweis was therefore the first to describe a nosocomial infection and provide an intervention to avert its spread through hand hygiene. There are many types of nosocomial infections patients can acquire, but today we will be discussing the most abundant and common ones seen in healthcare. A survey conducted in 183 United States hospitals with 11,000 patients reported that 4% of patients had at least one nosocomial infection, with the most common microorganism being Clostridium difficile, or C. diff. A study 2 years earlier by the same group found that 6% of patients had suffered from nosocomial infections, with the top 75% acquiring surgical site infections, urinary tract infections, pneumonia, and bloodstream infections. Staphylococcus aureus was the most frequently detected microorganism. Nosocomial infections are also problematic elsewhere in the world. For example, a study in Singapore reported 11.9% of patients with nosocomial infections, primarily sepsis and pneumonia, caused mainly by Staph aureus. Two other common bacteria are Klebsiella pneumoniae and E. coli, which are very resistant to antimicrobials, causing it to be very hard to treat. These four bacteria help to make up around 80 to 87% of all nosocomial infections, with 8 other microorganisms being in that group. A study conducted in 8 university hospitals of Iran reported an overall nosocomial infection frequency of 9.4%. The most common nosocomial infections were bloodstream infections or sepsis, surgical site infections, urinary tract infections, and pneumonia. Most of these infections occur in the intensive care unit of the hospital, and patients who stay for more than 8 days have a much higher chance of getting an infection. Surgical site infections are still one of the most common adverse events that occur in hospitalized patients undergoing surgery. Between 2% and 36% of patients may develop surgical site infections, with the highest risk for orthopedic. Approximately 25% of patients with surgical site infections develop severe sepsis and shock and are moved to an ICU. They cause statistically significantly morbidity, mortality, and financial burdens for individuals and for communities. Internationally, UTIs are the most common nosocomial infection and one of the top-ranking microbial infections, representing around 40% of nosocomial infections. They have significant consequences for morbidity and mortality of substantial final complications. The indwelling catheter, with E. coli being the main infecting pathogen microorganism. Pneumonia is the second most common nosocomial infection in the ICU, affecting more than 1/4 of patients. Around 86% of nosocomial infections are associated with motorized automatic ventilation. This has been identified internationally as a potential major cause of death. There are many ways that nosocomial infections can be acquired. It can be due to both patient and healthcare staff. These include, for example, patients' characteristics such as age or underlying disease or conditions that may compromise the immune system, presence of indwelling or invasive medical devices such as catheters or breathing tubes, complications from surgical procedures, and antibiotic use. The risk of infection related to invasive devices increases the longer the device is left in place. Patients in the healthcare setting are also at increased risk of nosocomial infections from exposure to organisms that are transmitted between patients and healthcare workers. Overuse of antibiotics also contributes to the problem of nosocomial infections by promoting the emergence of antibiotic-resistant organisms that cause nosocomial infections and are difficult to treat. Limited treatment options may also prolong the patient's stay. Up to 50% of antimicrobial use in hospitals is unnecessary and inappropriate and also contributes to the growing problem of C. diff infections, which are at historically high levels. Healthcare staff also have a lot to do with the increasing numbers of nosocomial infections. Staff have been shown in studies to not wash their hands with soap and/or alcohol rub before touching a patient, before cleaning and aseptic procedures, after body fluid exposure and risk, after touching a patient, and after touching patient's surroundings. Also, even though they may be taught when starting their job how to lower the spread of infection, the proper techniques slowly start to fade as they get more comfortable with the job. The World Health Organization advocates that effective hand hygiene is the single most important practice to prevent and control nosocomial infections. Several studies report that a simple and straightforward process, taking only a few seconds to clean hands with an alcohol-based hand rub, helps prevent nosocomial infections and save lives, reduce morbidity, and minimize healthcare costs. The Royal College of Nursing in the UK also promotes and advocates that all healthcare professionals must receive compulsory infection control training as a part of their introduction in an ongoing annual basis. It is particularly important that knowledge and skills are continually adapted. Multiple research studies indicate that policy changes and the adoption of novel, multifactorial, multi-module, multidisciplinary strategies offer the greatest possibility of success in terms of hand hygiene improvement and the reduction of nosocomial infections. Specific individuals acting as change champions, which is someone who can make sure that the staff is changing their ways, can act as an arbitrator or negotiator, contributing to changing behaviors and implementing best practice to ensure patient safety. In the early to mid-19th centuries in both Europe and the USA, thousands of young women died from puerperal sepsis and fever, the diseases rampant in the charity maternity clinics of the time, and due to the efforts of, among others, Dr. Semmelweis, the fight against puerperal fever was won, and it was confirmed that nosocomial infections were transmitted via the hands of healthcare workers. After discussing the most common types of the bacteria and the ways the bacteria are spread via patients and staff, we now have a better understanding of what we can do to fix the issues occurring. Despite the development of many high-tech methods, hand washing with soap and water or alcohol rub is still the most important means of maintaining personal hygiene and preventing nosocomial infections. Also, making sure employers keep up to date on staff infection control training and serving consequences to those who do not is an important factor to keeping the pace going. However, Due to the rise of antibiotic-resistant bacteria and a reluctance of some healthcare workers to implement best practice infection control, nosocomial infections remain one of the biggest causes of death in most countries. Therefore, it is essential that strategic, policy, and education initiatives continue to focus on managing and controlling such infections. These are the references used to find the information for this video.